Hi, thanks for joining again. Today I have Brad Saltzman. Brad is actually calling us here via Skype. He has an office in New York City, but today we're going to be joining him in a Skype call. We're talking a little bit about sexual addiction. And Brad, thank you very much for joining the program today.
Sure, thanks for having me.
So, we were talking a little bit before the broadcast about this whole idea of sex addiction, and one thing that came up is that sort of myth. Is sex addiction a real addiction, or is it simply an excuse for bad behavior?
Right. So, this is sort of the question that I always get asked about this. And, because people say, hey, doesn't everyone really like sex? And, is this just something they made up to excuse people who get caught for having affairs, that kind of a thing? But the answer is sex addiction is very real. It's as real as alcoholism or drug addiction. I think what people struggle with is they say, how could something that's so normal be an addiction? In other words, we're all wired to want sex. So, people tend to think of it as either it has to be a substance. But what we know now, addiction is not just about substances. It can also be about processes. So along with sex addiction, also food addiction is a very real addiction as well. We see that on both ends of the spectrum. We have compulsive overeating. We also have anorexia and bulimia.
So how does someone know if they're a sex addict?
Okay, so basically, if someone is engaged in sexual behaviors that are compulsive, in other words, they find that they're doing them even when they don't want to be doing them, or they're doing them and there have been consequences for them, or there will be serious consequences, and they still can't stop. So in other words, someone has been caught by their wife. They've been caught either having an affair, looking at pornography online, whatever it is, going to massage parlors, and their wife has caught them and threatened to leave, and they're still doing it, right? Or they are getting themselves into situations that are extremely risky. They're looking at pornography at work. There was something in the news very recently, just I think yesterday, about a court clerk who, while sitting in court during a rape trial, was looking at pornography while in the court because he was bored. He got caught. It turned out they found child pornography in his home, and I think he's going to be in a lot of trouble. But sex addiction or pornography addiction is not just about pedophilia. It's not just about child molesters. It's actually even people who seem to be very normal, functional people who have this issue.
And what kind of treatment is there for this kind of sex addiction?
Well, basically, to treat it, you have to first, the first thing you have to do is make a correct assessment. In other words, not everyone who comes into your office, saying that they have a problem with sex is a sex addict, right? And just because someone may have had an affair, that also doesn't make you a sex addict. So the first thing to do is make sure that you're properly assessing the situation. You're assessing the individual. You're getting all the information. To do that, I have a few tests that I give, assessments that are very comprehensive that help to sort of distinguish whether or not someone is an addict. Once we've established whether or not they're actually an addict, then the treatment is a combination of talk therapy and some more experiential therapies, like let's say actually acting out, like some psychodrama they call it. Group therapy is very important, being together with other sex addicts. There's working on your thought patterns, cognitive therapy, and also behavioral therapy. Actually changing the behaviors that you're involved in.
So just liking a lot of sex doesn't necessarily mean you're a sex addict.
Right. Everyone may want sex to some degree or another, but that doesn't mean that everyone is a sex addict. It is a very real disease, and in my practice, I've seen people who literally have had their lives turned upside down and destroyed. I mean, I've had people who come in because they've given their wife, I had one client who came in, he gave his wife an STD, and she only found out about it at the gynecologist. And this is someone who she never would have suspected of this. I had other people who, I had a man who his wife caught him looking at gay porn, and he's not gay, and he's not interested in men, and he has no idea why this is happening. and this is actually another phenomenon that we're seeing a lot more of, that basically as people continue to look at pornography, they need more and more extreme stimulus. There's something that may not even be normally stimulating for them. They need something like that just to get them turned on. So this is a really pervasive problem. Any place where you have the internet, this is a real risk, and no one, whether they're young or old, I have people in my 60s and I have people who are in their late teens, no one is immune to this.
So what should spouses do if they suspect that their husband or wife might be a sex addict?
Okay, so, I would say that the best thing to do would be possibly to confront their partner, and that doesn't mean in a nasty or aggressive way, but to say, hey, I saw this stuff on your computer, or I'm really concerned you're staying up till 2 a.m. every night on the computer. I don't know what you're doing, or, I saw these mysterious texts or whatever, and to say, hey, what's going on? And I understand that under the circumstances that may be a pretty heated exchange, but I'd say the first thing a person should do is probably bring it up to their partner and see. Some partners might say, yes, it's true, I have this problem, and I'm really glad that you found out because now I don't have to keep it a secret. Others may be in denial, but I'd say the second step would be to try and seek some kind of professional help. And the key there is to try and find a therapist who's been specifically trained in treating sexual addiction. A lot of therapists are not trained in this, and a lot of therapists don't understand this. They may have good intentions, but that's not enough. This is a real disease, and it really needs to be treated the right way. So I would strongly recommend finding someone who has experience and training in this specific area. Yeah.
So obviously this is a very complex problem that's invaded a lot of family homes, a lot of lives, a lot of couples. Brad Saltzman is a specialist, a psychotherapist, and a sexual addiction specialist. Brad, how would our audience be able to get a hold of you again?
Okay, so you can check out my website, which is just my name, www.bradsalzman.com. In addition to that, you can call me, and that's probably, I would say, the recommended way to get in touch with me. My phone number is 917-512-3490, and I do offer a free consultation for my clients because a lot of this can be a pretty intimidating process for a lot of people. There's a lot of shame and embarrassment around this, so I try to make that a little bit easier for people by offering them this consultation over the phone for free. They can talk to me a little bit, in the safety of their own home. It's a little bit less threatening, and they can get to know who I am a little bit on the phone before they make the decision they want to come in and see me.
Yeah, very important kind of first step. So thanks very much, Brad. We appreciate your time and a little bit of insight in this whole world of sex addiction. Appreciate your time.
Sure. My pleasure. Thank you very much.